Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Class 3. Class 3 is if there is failure of Mullarian duct to fuse in the entire length. If Mullarian duct fails to fuse in the entire length, then it is called as didelphic uterus. It has two fallopian tubes, two uterus and two cervix are the hallmarks. But there can be either one vagina or two vaginas may be present, or vaginal septum may be seen. Two cannulas should be used in hysterosalpingography for didelphic uterus. Class 4. In class 4, both Mullarian ducts are present. Here, because both Mullarian ducts are present and fusion began, but the fusion fails to complete. So here normally fusion begins from the caudal end and it goes cranially. So because the fusion begins from the caudal end, there is always a single cervix. So this is called as bicornuate uterus. In bicornuate uterus, there are two fallopian tubes, two uterine cavities, one cervix, one vagina, and there is abnormal external appearance. Sometimes if there is only one cervix present, then it is called as bicornuate unicollis. If there are two cervix are present, then it is called as bicornuate bicollis. Most of the times only one cervix is present, so it is bicornuate unicollis, but sometimes bicornuate bicollis cases are also seen.
thank you and thank you for watching.